compare the health situation in two communities. What are the other uses of indicators of health? According to WHO, health status of a community can be measured and compared by comparing various health indicators. However, there is no single indicator which can compare health status amongst two communities because health is multidimensional, and each dimension is influenced by numerous factors, some known and many unknown. Therefore, health must be measured multidimensionally. Thus, health must be conceived in terms of a profile, employing many indicators, which may be classified as mortality indicators, morbidity indicators, disability rates, nutritional status indicators, healthcare delivery indicators, utilization rates indicators of social and mental health, environmental indicators, socioeconomic indicators, health policy indicators, indicators of quality of life, other indicators, mortality indicators. Crude death rate. Crude death rate is number of deaths per 1,000 population per year in a given community, indicates rate at which people are dying. Considered a fair indicator of the comparative health of the people. Disadvantage: health should not be measured by number of deaths that occur in a community, but in many countries, crude death rate is the only available indicator of health. Usefulness of crude death rate is restricted for international comparison because it is influenced by the age, sex, composition of the population. Significance: although not a perfect measure of health status, a decrease in death rate provides a good tool for assessing the overall health improvement in a population. Expectation of life. Life expectancy at birth is the average number of years that will be lived by those born alive into a population if the current age-specific mortality rates persist. Life expectancy at the age of I excludes influence of infant mortality, and life expectancy at the age of 5 excludes influence of child mortality. Life expectancy at birth is used most frequently and estimated for both sexes separately. An increase in expectation of life is regarded, inferentially, as an improvement in health status. Disadvantage: life expectancy at birth is highly influenced by the infant mortality rate where that is high. Significance: life expectancy is a good indicator of socioeconomic development in general. As an indicator of long-term survival, it can be considered as a positive health indicator. It has been adopted as a global health indicator. Infant mortality rate. Infant mortality rate is ratio of deaths under 1 year of age in a given year to the total number of live births in the same year, usually expressed as a rate per 1,000 live births. Significance: infant mortality rate is a very comprehensive indicator, a sensitive indicator and a most important and universally accepted indicator of health status not only of infants, but also of whole population and of the socioeconomy conditions under which they live. In addition, the infant mortality rate is a sensitive indicator of the availability, utilization and effectiveness of health care, particularly perinatal care. Child mortality rate. It is defined as the number of deaths at ages 1-4 years in a given year, per 1,000 children in that age group at the midpoint of the year concerned. Excludes and mortality. Significance: apart from its correlation with inadequate MCH services, it is also related to insufficient nutrition, low coverage by immunization and adverse environmental exposure and other exogenous agents. Indicates the magnitude of the gap and the room for improvement. Under 5 proportionate mortality rate. It is the proportion of total deaths occurring in the under 5 age group. This rate can be used to reflect both infant and child mortality rates. High rate reflects high birth rates, high child mortality rates and shorter life expectancy. Maternal mortality rate. It is the ratio of death of women in the puerperal period in a given year to the total number of live births in the same year, usually expressed as a rate per 100,000 live births. Significance: maternal mortality also indicates the quality of services provided to mothers of reproductive age group, i.e., natal and postnatal services. Disease-specific mortality. It is the mortality rate computed for a specific disease. Proportional mortality rate. It is the simplest measures of estimating the burden of a disease in the community. It is the proportion of all deaths currently attributed to it. Significance: proportional mortality rate from communicable diseases has been suggested as a useful health status indicator. It indicates the magnitude of preventable mortality. Significance: mortality indicators represent the traditional measures of health status. Even today they are probably the most often used indirect indicators of health. With control of infectious diseases, mortality rates have declined to very low levels in many countries, resulting in Lesser sensitivity of mortality indicators as health indicators in developed countries. However, they continue to be used as the starting point in health status evaluation. Morbidity indicators assess ill health in community. I incidence and prevalence. IL, notification rates. LIL, attendance rates at outpatient departments, health centers, etc. 4. Admission, readmission and discharge rates. V. Duration of stay in hospital. V. Spells of sickness or absence, from work or school. Disadvantage. Morbidity indicators tend to overlook a large number of conditions which are subclinical or inapparent, that is, the hidden part of the iceberg of disease. Significance. Morbidity indicators supplement the mortality indicators to describe the health status of a community as they reveal the burden of ill health in a community. Disability rates. Disability rates are based on premise or notion that health implies a full range of daily activities. Number of days of restricted activity. Bed disability days. 1 illness days, or school loss days, within a specified period. Mediation of mob lay confined to bed. Confined to the house. Equal aid in getting around either inside or outside the house. Limitation of activity. Limitation to perform the basic activities of I. Sullivan's Index. Sullivan's Index represents expectation of life free of disability, computed by subtracting from the life expectancy, the probable duration of bed disability and inability to perform major activities, according to cross-sectional data from the population surveys. Significance. Sullivan's Index is considered one of the most advanced indicators currently available. HALE, Health-Adjusted Life Expectancy. Measures life expectancy at birth but includes an adjustment for time spent in poor health. Most easily understood as the equivalent number of years in full health that a newborn can expect to live based on current rates of ill health and mortality. Exclamation point, NE. Daily, Disability Adjusted Life Year, measure of the burden of disease registered sign in a defined population and the effectiveness of interventions. Dailies express years or life lost to premature death and years lived with disability adjusted for the severity of the disability. 1 daily is 1 lost year of healthy life. Dailies are advocated as an alternative to CALIs and claimed to be a valid indicator of health. Daily equals ill, years of lost life, plus ILD, years lost to disability. Expressed as number of years lost due to ill health, disability or early death. Disadvantage. Use of daily is limited because necessary data are not available or do not exist. Moreover, the concept postulates a continuum from disease to disability to death that is not universally accepted, particularly by the community of persons with disabilities. Significance. Disability rates related to illness and injury are used to supplement mortality and morbidity indicators because death rates have not changed markedly in recent years, despite massive health expenditures. Nutritional status indicators. Positive health indicator 1. Anthropometric measurements of preschool children, e.g., weight and height, midarm circumference, heights and weights of children at school entry. IL. Prevalence of low birth weight, less than 2.5 kg. Healthcare delivery indicators. I. Doctor population ratio. ID doctor nurse ratio. LIL. Population bed ratio. 4. Population per health subcenter. V. Population per traditional birth attendant. Significance. These indicators reflect the equity of distribution of health resources in different parts of the country, and thus of the provision of health care. Utilization rates. Utilization of services, or actual coverage, is expressed as proportion of people in need of a service who actually receive it in a given period, usually a year. Based on fact that there exists a relationship between utilization of healthcare services and health needs and status. Examples. L. Proportion of infants who are fully immunized against the 6 AP diseases. LL. Proportion of pregnant women who receive antenatal care, or have their deliveries supervised by a trained birth. IL. Percentage of the population using the various methods of family planning. 4. Bed occupancy rate registered sign. LA. Average daily inpatient census. Average number of beds. Average length of stay. LA. Days of care rendered. Discharges. V. Bed turnover ratio. LA. Discharges. Average beds. Disadvantage. Healthcare utilization is also affected by factors such as availability and accessibility of health services and attitude of an individual towards his health and the healthcare system. Significance. Utilization rates give some indication of the care needed by a population, and therefore, the health status of the population. These indicators direct attention away from the biological aspects of disease in a population towards the discharge of social responsibility for the organization and delivery of health care services. Indicators of social and mental health. These include suicide, homicide, other acts of violence and other crime, road traffic accidents, juvenile delinquency, alcohol and drug abuse, smoking, consumption of tranquilizers, obesity, eat. To these may be added family violence, battered baby and battered wife syndromes, and neglected and abandoned youth in the neighborhood. Significance. These social indicators provide a guide to social action for improving the health of the people. Environmental indicators reflect quality of physical and biological environment in which diseases occur and in which the people live. Include indicators relating to pollution of air and water, radiation, solid wastes, noise, exposure to toxic substances in food or drink. Most useful environmental indicators are those measuring the proportion of population having access to safe water and sanitation facilities. Socioeconomic indicators. These indicators do not directly measure health, nevertheless, they are of great importance in interpretation of healthcare indicators. Examples 1. Rate of population increase. LIL. Per capita GNP. LIL. Level of unemployment. 4. Dependency ratio. Literacy rates registered sign, especially female literacy rates. V. Family size. MIL. Housing, the number of persons per room. VIL. Per capita calorie availability. Health policy indicators. Single most important indicator of political commitment is allocation of adequate resources. Examples. 1. Proportion of GNP spent on health services. LI. Proportion of GNP spent on health-related activities including water supply and sanitation, housing and ton, community development. LIL. Proportion of total health resources devoted to primary health care. Indicators of quality of life. Previous emphasis on using increased life expectancy as an indicator of health is no longer considered adequate, especially in developed countries, and attention has shifted more toward concern about the quality of life enjoyed by individuals and communities. Physical Quality of Life Index is one such composite index which consolidates 3 indicators, viz. Infant mortality, life expectancy at age 1, and literacy. Other indicators. Social indicators. Social indicators, as defined by United Nations Statistical Office, have been divided into 12 categories: population, family formation, families and households, learning and educational services, earning activities, distribution of income, consumption, and accumulation, social security and welfare services, health services and nutrition, housing and its environment, public order and safety, time use, leisure and culture, social stratification and mobility. EIL, Basic Needs Indicators. Basic needs indicators are used by ILO and include calorie consumption, access to water, life expectancy, deaths due to disease, illiteracy, doctors and nurses per population, rooms per person, GNP per capita. IL. Health for All indicators. For monitoring progress towards the goal of health for all by 2000 AD, WHO has listed following 4 categories of indicators. Self-help groups in Karnataka. A recent intervention is the Karnataka government's Stree Shakti Women Power program launched in 2000. The government of Karnataka realized that, despite implementing many programs which aimed at social, economic, and overall development of rural women, it could not empower women or build up their confidence. The Stree Shakti program led to the formation of 100,000 SHGs, covering 2 million